Vaginal discharge during pregnancy. All women, whether they're pregnant or not, have some vaginal discharge starting a year or two before puberty and ending after the menopause. How much discharge you have changes from time to time, and it usually gets heavier just before your period. Is it normal to have vaginal discharge in pregnancy? Almost all women have more vaginal discharge in pregnancy. This is quite normal and happens for a few reasons. During pregnancy, the cervix, neck of the womb, and vaginal walls get softer and discharge increases to help prevent any infections traveling up from the vagina to the womb. Increased levels of the hormones progesterone can also make you produce more fluid. Increased discharge is a normal part of pregnancy, but it's important to keep an eye on it and tell your doctor or midwife if it changes in any way. How does vaginal discharge change during pregnancy? Increased discharge can be a sign that you are pregnant, though many things can influence vaginal discharge, so you can't be sure this is the reason. The amount of discharge may increase throughout the pregnancy. Towards the end, there may be so much you confuse it with urine. Towards the end of pregnancy, the amount of discharge increases and can be confused with urine. In the last week or so of pregnancy, your discharge may contain streaks of thick mucus and some blood. This is called a show, and happens when the mucus that has been present in your cervix during pregnancy comes away. It's a sign that the body is starting to prepare for birth, and you may have a few small shows in the days before you go into labor. When to see your midwife or doctor? You should tell your midwife or doctor if your vaginal discharge increases a lot in later pregnancy. If you have any vaginal bleeding in pregnancy, you should contact your midwife or doctor urgently, as it can sometimes be a sign of a more serious problem such as a miscarriage or a problem with the placenta. Normal healthy discharge should 1. Be clear and white. 2. Not smell bad. Tell your midwife or doctor if 1. The discharge is colored, greenish or brownish. 2. There is blood in the discharge. 3. It smells strange. 4. You feel itchy or sore. If the discharge is colored or smells strange, or if you feel itchy or sore, you may have a vaginal infection such as thrush, which your doctor can treat easily, or bacterial vaginosis. Do not try to treat it yourself. Always talk to your doctor, pharmacist or midwife if you think you have an infection. You can help prevent thrush by wearing loose cotton underwear, and some women find it helps to avoid perfumed soap or perfumed bath products.